Welcome to our Medicare Insights podcast. I'm Ron Lang, CEO of CalCPA Health. CalCPA Health provides group insurance to CalCPA member firms, and by regulation, we're not allowed to provide Medicare products, consulting, or advice. So today, we're calling on an expert in all things Medicare, Amy Conchola. CalCPA Health has been working with Amy for many years, referring CalCPA and CalCPA Health members to her for her guidance on Medicare topics. She works for our longtime business partner, Anthem, which a couple of years ago rebranded themselves as Elevance Health. So welcome, Amy. Can you share a bit of your background with our audience?
Thank you so much, Ron. Hello, everyone. Our parent company name is Elevance, and that's a combination of the words elevate and advance, which is what we're striving to achieve and accomplish with healthcare for future humanity. I work at Anthem for over 20 years now, and I've pretty much been in every business segment, the under 65 non-group side, the group side, and Medicare. So really just have gone full circle with my career at Anthem. I'm extremely blessed. And I attend University of Phoenix as a health administrator, master's, and I'm passionate about teaching Medicare because this topic is very important for future financial wellness, security, retirement planning, and preparation. Many parents, grandparents might be affected. This can keep, workers from getting things done. And so many of us spend many years paying into the Medicare system. And so it's important to take advantage of not only what was earned, but to stay away from any penalties that could be incurred.
And as I mentioned that regulatorily, we don't get involved in Medicare, but you're, I don't know if it's a licensing or a registration process, but you're allowed to do that kind of thing. What are the certifications that you need to be able to counsel people on Medicare?
Yeah, so I'm licensed with the Department of Insurance for California, and I also hold a Medicare Advantage and Part D certification. That's an annual certification in order to sell those type of products.
Well, when you start discussing Medicare, it's hard to know where to start. Do you start with enrollment or do you start with the plans? And I was thinking, well, if we start talking about enrollment, we're going to be talking about plans, and we hadn't talked about those yet. So I think we're probably best off starting talking about the various plans. So I know that there's many parts. There's A, B, C, D. Can you explain to our audience what all those are?
Yeah, so starting with Part A, this is hospital insurance for inpatient, skilled nursing facility, hospice, home health, and blood, and this would be in a hospital setting. And then we have Part B. This is medical insurance for doctor services like general or specialty care. These include services like annual preventative exams, outpatient services, supplies, labs, durable medical equipment, diabetic testing equipment, supplies, home health services, outpatient physical, occupational, speech therapy. This could also include outpatient mental health care services, outpatient prescription drugs administered in the office. So this is going to be the injectable and infused drugs, maybe for chemotherapy or dialysis. And for Part B covered services, you have a deductible of $257. And then you would be responsible for 20% of the Medicare approved amount after you meet your deductible. This would be called coinsurance. And then Medicare would pay 80%. And the biggest thing is that there's no out-of-pocket limit on Part B. And you may pay a monthly premium for Part B. And you can pay more depending on your income. We'll talk more about that. But the biggest thing is there's no out-of-pocket limit on Part B. And so original Medicare Part A and B is really not enough coverage for most people. And so additional plans are purchased through private insurance companies. And one of the main options purchased is going to be that Part C. This could be either HMO or PPO networks, and these include benefits like vision, hearing, dental, maybe some over-the-counter health-related items, transportation to offices. These plans usually include no or very low premiums. And Part D is drug coverage. This can consist of deductibles, copays, and coinsurance for tiers of prescriptions. And Part C and D, again, are offered through private insurance companies, whereas Part A and B are administered through the Social Security Administration. And then we also have Medicare Supplement, also known as Medigap, and we can talk more about that.
So when we hear about, I hear a lot about Medicare Advantage plans. So where do those fit into those categories?
Yeah, so for Medicare Advantage plans, these are also known as Part C, and these usually include drug coverage and additional benefits. But you do have to have Part A and B in order to have this type of plan. But they, again, are going to come with various other benefits like vision, dental, and over-the-counter benefits or transportation. Sometimes they even cover utilities. So these are offered through private insurance companies, and they are low to zero premiums because these have networks. And so the biggest thing is if you have a particular provider, making sure that your provider is going to be in the network.
Yeah, I know you mentioned that they can be PPO or HMO on Medicare Advantage plans, and so the ones that I'm most used to seeing are the HMO type, where you've got a primary care doc and you're in that medical group's care for your plan, and then they can vary greatly depending on what market you're in. Like, the Southern California market has lots of options. And then there's other areas of the country or even in the state where you don't have as many options.
Yeah, exactly. And, I would say there's a little bit more freedom with PPO than HMO. You do tend to see more HMO in the market than PPO. They try to really control those costs a lot on the HMO side of things.
And then it seems like every time I'm watching a movie late at night on TV, they have a commercial that comes on and says, check your Medicare plan benefits, call this 800 number. What are those all about?
Yeah, so these are probably most likely agencies who are trying to sell individual insurance plans. And you may see increased marketing activity during the annual enrollment period. This goes from October 15th to December 7th. And the marketing for these begins in October 1st. And this is for Medicare Advantage and Part D members when they want to change their plan. And you should always use a reputable, licensed, certified, and professional insurance agent. We include a vast network to assist you, and you can always reach out to us. But, they are not supposed to be calling you directly. That is one of the things to kind of know. It is illegal for insurance agents to be calling you. I know in the past this has kind of happened. So you most likely want to report that if that does happen.
Yeah, I think I've heard from people that they get calls about Medicare plans, and that I was always under the impression that there were regulations that prevent that type of outreach, which is why people get a lot of postcards in the mail or TV ads to get them to contact the Medicare agency or insurance company, so that the outreach is going it's in reach, not outreach, I guess would be the way to put it.
Yeah, and the thing is that Medicare is not going to send anything proactively. So you really need to be on top of this at age 65. They are not going to automatically enroll anybody unless they're collecting Social Security benefits at age 65. then they're automatically going to enroll you in Part A and B. And you can decline Part B, but you cannot decline Part A.
So you mentioned the Part A and that most people have paid into the system, and so Part A premiums are covered. What about Parts B and D? I know that they do have premiums.
Yeah, good question. And let me just add one more thing on Part A, if you will. Part A is a zero premium only if you or your spouse worked at least 10 years and paid Medicare or FICA taxes. So that's why a lot of people will take out Part A for free, or zero premium. Now, Part B starts at $185 in 2025 this year. I've usually seen it go up about $10 or so per year. And this is going to depend on your modified adjusted gross income. So I said it started at $185, but the more modified adjusted gross income that you make, the more that you could pay for Part B. They charge more for higher income earners, and they look at your tax return from 2 years prior and your modified adjusted gross income in order to determine those amounts. And they also look at the way that you file your taxes. And so this is really important to know. I would say if somebody's going on to Medicare at age 65, they're going to want to know this information at 62 or 63 so that they can plan for that tax-wise. If somebody's married and they file separately, they can end up paying a lot more for Medicare Part B and D. So for Part D, those premiums are around $36, $37 in 2025. We probably will see these going up next year because of the benefits of Part D. They did change this year quite substantially. Another thing to note about these premiums is that as your income changes, let's say in retirement you're selling a home or you're selling stock that you have, mutual funds, those are going to affect your modified adjusted gross income, and the Social Security Administration is going to automatically adjust for those annually.
Other words or terms I hear thrown around are Medigap or supplemental.
Yeah.
Where do those fit into this maze of plans that they've created?
Yeah. So that is a setup where Medicare is going to pay primary and the Medicare supplement is going to pay secondary. It's different from Medicare Advantage in that the claims are sent directly to the private insurance company to pay on the Medicare Advantage side. Medicare does not see those claims on the Medicare Advantage side. That is why those plans are lower premiums, because there's one insurance company paying those claims. But for the Medicare supplement, Medicare's primary, the Medicare supplement is secondary. There's various plans that are common and popular. The plan that used to be most common was the Medicare Supplement F plan. And that plan stopped being offered per Medicare January 1st of 2020. So all the newly eligibles, the next most common plan is the G plan. And that is very comparable to the F plan, but the main difference is that it does not cover that Part B deductible of $257. So a little bit different. But you can expect to pay a little more on the Medicare supplement side. You're paying for the freedom of having that type of plan. And the Medicare supplement utilizes the Medicare network, which is 98% of providers nationwide. So it includes a lot more freedom And you're paying more for that freedom. So typically, the premiums on a Medicare supplement start at $150 and upward, depending what plan you go with. And that's just for the medical. Dental, vision, and prescription are going to need to be added on separately. And so it's kind of like a la carte menu in a restaurant, if you will. When you add everything on separately, you kind of end up paying more. Whereas a Medicare Advantage plan, you're bundling everything together and you're kind of getting a discount for that.
On those Medigap and Medicare supplements, you were talking about F's and G's, and so my understanding is that CMS. So we'll throw out some acronyms that the Center for Medicare Services, everybody refers to them CMS, that they set out a benefit structure and they label those with the letters F, G, H, I, J, whatever they have. And so when somebody's comparing, let's just say G plans from different insurance companies, all the benefits are the same. The only thing that's different would be the premium or the network. Is that the way they have that structured?
Yeah, that is correct. Those are what they refer to as standard plan designs. So the main differences are going to be the premiums, and the premiums are going to be determined by age. And so there are various discounts that carriers can offer, maybe for a household discount or the way that you pay, if you pay in advance type of thing. But the premiums are going to vary, which drives somebody to choose one carrier over another. And those premiums are directly tied to claims. So as the book of business performs, those claims are adjusted and annually.
Well, I think that's a good overview of the plans, and we'll be talking about plans as we go into enrollment, and that's where I want to head now. So I want to make this practical for the members that are listening, and probably the most common inquiry that we get at CalCPA Health is, I'm 64 years old. I'm going to retire on my 65th birthday. What do I do? How do I enroll? What should I do when?
Yeah. So, this is going to depend on what type of coverage you have. Depending on whether you have a non-group plan or group plan, this is going to be unique. And that's why I always stress to people that, don't just do what your friend or your neighbor did, because their situation could be very different from yours. But let's say that somebody's on a group plan of 20 or more. They could either enroll for Medicare at age 65 or they could delay it. The key is a group plan of 20 or more. So if you're on a group plan of less than 20 or a individual plan that's not group, you must enroll for Medicare at age 65 or they can penalize you. Medicare's primary for groups of less than 20 and for people who are on individual coverage. Also, those covered California tax subsidies, they don't continue on individual plans when somebody turns 65. So that's a reason why they most likely would want to enroll in Medicare. But on the group side of things, let's say that somebody's on a plan of 20 or more, and they want to delay Medicare. They can delay Medicare. There's nothing that they need to do, but when they go to enroll later, they're going to need to submit an employer verification form with their application to the Social Security Administration. And that form has to show that they had coverage from age 65 forward so that they're not penalized for not getting Part B at age 65. It's kind of like the proof that they have Medicare coverage. And that form is filled out by the Human Resource Department of whatever employers that person had from age 65 forward. If there's multiple or just one, you would need a form proving that you have that group coverage so you're not penalized. and that gets sent in with the Medicare application to Social Security.
So when somebody's approaching age 65, what's the enrollment window that they're working with?
Yeah, so that is a 7-month period, and that begins 3 months before 65, the month they turn 65, and an additional 3 months after that. And then if they enroll during the 3 months prior to their birthday, their coverage could actually start a whole month earlier if they have their birthday on the 1st of the month. Otherwise, the effective date is usually the 1st of the next month. And then I just also want to warn that Social Security takes about 3 months to process a Medicare application. So as soon as you know in advance, the sooner the better to start that process, because it can take up to 3 months. If for some reason you find yourself in a bind and you don't have that time, I recommend going into the Social Security office and asking for an expedite, or calling the Social Security Administration once the application is submitted to ask for that expedite.
And we have, once again, we have people asking us, they say, and you touched upon this a little while ago, they say, well, I haven't received anything from Medicare. I haven't received any notices. But you mentioned earlier that they typically don't send people anything as they're approaching 65.
That's correct. That's why I'm so pleased that you were able to offer this opportunity to teach about this proactively.
So you just talked a little bit about going into a Social Security office, but how do you actually enroll for Medicare at either age 65 or when you were going to retire at some older age?
Yes, you do that either by the website. I would recommend the website. I think that's the easiest and most convenient, ssa.gov. Otherwise, you can go into the Social Security Administration office, the local office in your area, to do that.
Okay. And so the enrollment process, so let's just say, we were talking about somebody turning 65. Let's just say, I think it's very common for somebody to work until somewhere around age 67 nowadays, because that's the Social Security full retirement age, or even later than that. So is the enrollment process the same for somebody that's 65 or somebody that's older? Although you mentioned turning in a form if you hadn't enrolled at 65, but is the process the same with either the website or the Social Security office, or how does all that work?
That process is the same. Great question. The one thing is that if you're age 65 and you're not on a health savings account plan making contributions, a lot of people enroll for Part A at age 65. And like I had said earlier, that's because them or their spouse probably worked those 10 years or 40 quarters to get that Part A at a 0 premium. Now, the one reason somebody would delay Medicare altogether and not start that process of Part A first is because they're on a health savings account where them or their employer are making contributions. That would result in a IRS tax penalty if they enroll in Medicare while making contributions or their employer. So you must you must stop your contributions in advance of enrolling for Medicare. And if you're past your initial enrollment period, that 7-month period we just spoke about, they actually retroactivate the Part A coverage up to 6 months. And so a lot of times you might hear, if you're making health savings account contributions, you need to stop your contribution 6 months in advance. And they also prorate that amount. So, important to plan for that ahead of time. But, that's why somebody might delay Part A and B altogether, or they might start Part A while they're on the group plan just to kind of start that process of having Part A. And it also gives them their claim number. So if they enroll in Part A and B or just Part A, they're going to get a unique claim number. It's not going to be their Social Security number. It's going to be numbers and letters. And this will stay with them. So if they enroll in Part A, they're going to have the same claim number for Part B. And so it just kind of helps start that process earlier on proactively if the contributions aren't being made at age 65.
So are there other considerations for somebody that's north of age 65 and hasn't retired yet, deciding on whether to do, either an ABD or a C or stay on their employer's plan?
Yeah, so I think the best case is just to compare all your options. That is the thing everybody wants to do. I would say a lot of times the group plan is going to make them a lot of sense because the employer is paying a good portion of the premium. The benefits are pretty comprehensive. So while you have that available and those benefits available to you, most people take advantage of that. And then when they need to come off that type of coverage in retirement, that's when they start looking at Part B, Medicare Advantage, Medicare Supplement. And really, it just depends on what somebody might be able to afford. If somebody was a good saver, maybe they can afford the freedom of having a Medicare Supplement and paying the extra premium. But if somebody wasn't an avid saver for retirement, they may want to go with the Medicare Advantage plan. Also, maybe it has to do with claim utilization. Maybe at that moment they're not sick and they want a Medicare Advantage plan at a lower premium because they don't want to be paying a big premium if they're not using those benefits. With Medicare Supplement, because they're paying more, maybe they're sick already, or maybe they want to have that freedom of choice of providers. It really just depends on their situation. But really the time for Medicare Supplement is going to be 6 months from your Part B effective date. That is when you can enroll for that product without underwriting. Otherwise, let's say you go on a Medicare Advantage plan and then a couple years later you decide you want to switch. You have to go through underwriting, medical underwriting, in order to get a supplement plan. And they could either rate you up, give you additional premium because you're already sick at that point, or they could decline you.
And we've mentioned a couple times about the Part B and Part D that there are enrollment windows which you were just talking about, and there are penalties relating to those. So how do the penalties work for B and D?
Yeah, so if they don't enroll in their initial enrollment period and they don't have a special enrollment period, a special enrollment period would be because they had group coverage of 20 or more. That would give them a reason to have a special enrollment period. If those two situations don't apply to them, then they would enroll in a general enrollment period. And for every 12 months that passes for Medicare Part B, you will pay 10% for each 12-month period that you were eligible for Part B but did not enroll. And that's a lifetime penalty. It doesn't go away. And you're going to pay that penalty for as long as you have Part B. Now, for Part D, as in drug, you may owe a late enrollment penalty for not joining a drug plan as well during that initial enrollment period, or for going 63 days in a row without a Part D creditable prescription drug plan. Now, creditable means that your current prescription benefits are equal to or better than the standard Medicare benefit. And so again, it's 63 days that you cannot go without a creditable plan once you turn 65. And let's say you do. That late enrollment penalty is 1% times the number of full uncovered months that you didn't have creditable coverage. And so again, you would also pay that for as long as you have the drug plan, and that amount can change annually.
Well, we have all these rules about enrollment and the different plans. Are there, and we've talked about how to do things, but I'll throw this kind of in the category of mistakes people make. For example, we just talked about if they didn't enroll in Part B on time or Part D on time, or they didn't do it correctly. Are there other mistakes, common mistakes that you see people making out there that either cost them one time or cost them for the entire life of their Medicare plan?
Yeah, so there is something kind of tricky. If you delay your enrollment in Medicare Part D, once you enroll after you delay it, the private insurance company you choose for your prescription drug plan is going to send you a certification or declaration that you had creditable coverage from age 65 forward. It's kind of like the employer verification form for Part B, but for prescription drug coverage, once you delay it and you enroll, the private insurance company is going to send you this declaration where you need to prove that you had creditable coverage. And so you sign off saying you have creditable coverage from this date to this date. You may want to hang on to those creditable coverage notices. They start at age 64 3/4, and they're mailed in September of every year. I'm sure you're familiar with that form, Ron. But it comes from the employer. And then, one of the other things on the prescription drug coverage we didn't hit on yet is that the change for 2025 was that the out-of-pocket maximum on those plans went to $2,000. So last year it was $8,000. This year it's $2,000. And so we did see price adjustments for that, and we're probably going to see that again next year. But it is better. The drug coverage has gotten better, but with that, you also might pay a bigger premium. Now, the prescription drug plans are going to vary based on the formulary and the amount the premiums are. So it's really important to look and see if all the drugs you're taking are covered, if you're taking any important prescriptions. That might get you to go with one carrier versus another. And then that can be changed annually. And that annual enrollment period, like I mentioned, is October 15th to December 7th of every year. That's when you can change your drug coverage. Otherwise, you're locked into that drug coverage for that year. So the other things, when somebody is making these types of decisions is that, not signing up for Part B and Part D in time, that can result in penalties. But, the health savings account situation, that could result in a penalty. So, plan and prepare in advance for kind of what you want to do. If something unforeseenly happens and you need to pivot, you can try to expedite things with Medicare. There are questions that come up with COBRA. Again, always best to compare all your options. So COBRA plan, Medicare Advantage, Medicare Supplement, what's going to be best. Those COBRA plans usually are an extension of the group plan. They do end up being pretty extensive premiums for that reason. But if somebody really is in the middle of care and they want to hang on to those benefits, that's a lot of times where somebody might go. But again, providers, prescriptions, those are going to make the biggest difference and kind of help you navigate the market to choose the type of plan you want. But do not go about it alone. There's reputable professional insurance certified agents who can help you. Let us know. We'd love to put you in touch with somebody. And then one last part is that the prior plan is not going to automatically cancel. So if you were on a group plan and you convert or transition to an individual Medicare plan, you'll need to cancel that with your employer or with the insurance carrier that you were with prior. That's not going to happen automatically.
Yeah, that's one that we get a lot. And we don't know what their Medicare date is, so we wouldn't know when to cancel that. And their employer doesn't know either. You have to communicate that, as you go. And, you had brought up COBRA, and we've spent a lot of time talking about people retiring after age 65. But then in our industry, in the CPA and financial services industry, we get people that are retiring early, those lucky people that get to retire at age 62 or earlier. And so at age 62, you can go on COBRA, a continuation of benefits under COBRA for 3 years, because we have CalCOBRA in California. That gets you to, 62 to 65, then you're on Medicare. That you can run into some issues if you're trying to retire before age 62, because that COBRA thing doesn't work. So, you could go on COBRA for 3 years, but then you'd probably have to go to the exchange or the individual market to fill that little gap there.
That's a really good point.
Yeah. Well, hey, Amy, thanks for joining us today and sharing all this information. We've covered a whole lot today. And I think you started off at the beginning talking about how every person's situation is different, and that you do need to get proper guidance and advice. I know that recently, for example, you and I were communicating with one of our members that was asking all these questions, but then they were also covered under their spouse's retiree plan, or were going to be covered.
A lot of options to compare.
So there's another whole thing that gets thrown into this mix. And so that just proves that everybody's situation is different as they're approaching this, and that they need to figure out their path to go through this. One of the things that we advise people to do, since I've already mentioned that we don't talk to people specifically about Medicare, that CMS has a publication called Medicare and Me, and we usually have the link on our website for people, but they can go to CMS's website. And I've found that people that read through that, or at least use the index to find what they're talking about, that I've gotten good feedback on that. They update it annually. But what we'll do is, any of our members can go to our website, or they can contact CalCPA Health, and we'll be able to put them in contact with you and your team, so that if somebody does need guidance or advice as they're transitioning, if it's now or if it's 3 years in the future, they can discuss this with you and your team there at Anthem. So we'll have that on our website, and we'll have the information at this podcast.
That's a great handbook and guide. We would love to help. I know that this can be overwhelming, all the differences and comparisons. Don't go about it alone. Give us a call, and, we're here for you. So I would say the more options, the better. It gives you more options. So don't be overwhelmed by it.
All right. So for all the members that are joining us today, we hope that you got some practical information out of today's podcast, and look forward to more podcasts in the future on this and other topics.
Thank you so much for the opportunity, Ron.